I think one of the most interesting things about the training program was the fact that it was primarily in two hospitals: the Veterans Administration Hospital on Beacon Hill in Seattle and the Harborview. The residency program went between the two of them, but yet the medical school was out on the University of Washington campus. One of the most interesting things about it was the movement back and forth of Arthur Ward and Eldon Foltz, who was also a postdoctoral fellow under Art Ward and then became a partner, was the constant race down 23rd Avenue from one hospital to the other, VA to the university, and then trying to protect yourself when you had to park in the parking lot by the Harborview Hospital, because they used to lift your bag out of the back of the car all the time and many things. It was really a very interesting time. And of course, it was the time that we were just beginning to think about training people to be on the scene in accidents. And the Harborview Hospital was the only hospital that they would take major central nervous system trauma to, and if it was central nervous system and the patient was unconscious, he went to what we call 4 North. And 4 North was the primary neurological surgery ward, but it was secondarily associated with urology, which made a very interesting thing, and this is a little anecdotal, but we used to call the ward plumbing and wiring because we had the two sitting there together. But the thing that was important was the room that all the unconscious patients went to. This was known as the headroom. And I think this is where your critical care really developed in it. And the entire training program generated with the firemen in the King County area, which was one of the earliest of these training programs in the United States, all centered around these seriously injured individuals, unconscious, coming into a central area. But the big thing was to train people to handle the problem in the field. And the other anecdotal thing that I can remember was one of the internists that was training the firemen was giving a lecture on the general causes of unconsciousness, and one of the firemen raised his hand and said, well, one of the things that I'm seeing out here is not the unconscious patient, but so many people with strokes, and what can I do for them? And he made a suggestion, and this was really rather interesting, his suggestion. He said, you know, there's not a lot you could do, but why don't you just give them a couple of aspirin and bring them in? Now, that was sort of the beginning of a very interesting story that we tend to lend to the Japanese, but it was actually first done right here in the Seattle area. And now we know that the best thing you can do for a stroke when you get a call on the telephone is take 2 aspirin and come on in. But the firemen do it now.